Unlocked is brought to you by Invincible, a program designed to unlock the potential of people and teams inside your organization. Join companies like Pfizer, Delta, the CDC, Google, and Chick-fil-A, and others in over 116 countries that are currently using this program to increase productivity and develop healthy cultures. Access hundreds of hours of content that is accessible anytime, anywhere. And finally, use real-time data to understand the health of every team inside your organization, which teams are performing and which ones aren't. Then understand the why behind that performance. Get free access to Invincible for 30 days by visiting www.giant.tv/30days. Dr. Carlene does not mess around when it comes to company culture. Company culture is part of their organization. It's part of everybody's organization, but developing company culture is something that Brooklyn Minds puts a super, super big emphasis on, with everything from who they hire to the patients they take on, and mirroring those and making people feel involved and included. It's so critical. And they understand this. They're using technology to help bridge the gaps of communication and understanding within their organization. They are using all types of tools to help foster that communication when there's people that have problems or insight or lacks understanding. And the way that a group of psychiatrists work to understand one another is super, super relevant and important. I really love this interview. She is a company culture powerhouse superhero, and I am so happy to have had her on the show and had this discussion. You're definitely going to learn about some things. We talk a little bit about the practice beforehand, and then we get into some really heartfelt discussion about how to use company culture to make sure that we are all aligned and doing the right things that we need to be doing. So let's do this. I'm super excited. Dr. Carlene MacMillan. Hey, welcome everybody to an episode of Unlocked. I'm here with somebody that believes in culture, that believes in not just the culture in the workplace, but the culture outside of the workplace and bringing that into the workplace because of everything they believe. So Dr. Carlene MacMillan of Brooklyn Minds, welcome. Give us a little tiny rundown of what you do. Why Brooklyn Minds? What is
Sure.
it?
So thanks so much for having me. I'm an adult and child psychiatrist by training, and about 4.5 years ago, formed Brooklyn Minds with my husband, who's also a psychiatrist. And we've grown over that time to be a multi-site, comprehensive mental health practice, taking care of some of the most kind of complex psychiatric concerns, I would say, in the New York City area.
And you deal with the hard stuff.
Mm-hmm.
You don't take the softballs, it looks like. I mean, and that's kind of something you wanted to focus on. And why is that?
Yeah, so I think we really have a team-based approach to mental health. I think a lot of complex medical concerns require a team. And what we found in mental health was really a lot of people in kind of more of a solo practice model who really weren't able to take care of some of the more complicated, sicker individuals. And so those individuals end up going to emergency rooms, going to hospitals, kind of going into a revolving door type pattern because they're not really getting that help that they need. And so by forming more of a team-based approach where we have multiple clinicians and team members working with an individual patient, we're able to keep people in the community, in their lives in a more meaningful way more of the time. So that's why we do that. And that's part of why culture is important, because we have this team approach. We're not working in our little silos in our little offices. We're very much working together.
Okay. I like that idea. And I like the inclusiveness of what that means, because it's not about the individual at the company. It's about how do we best serve the patient and the best way possible, and bring in multiple ways, multiple people that have different talents to be able to
Mm-hmm.
do that and serve that individual, right?
Absolutely. Mm-hmm.
When you are looking for these people to come work for you, and mind you, you have grown pretty quick. I mean, 4+ years, and you have, what'd you say, 50, 60
Yeah, between 50 and
people?
60 employees, many of whom are full-time. So yeah.
Awesome. Like, congratulations. That's
Thank
great
you.
growth and way to serve multiple people, to find a way to scale in a way that serves you and the community. So when you're looking, there's a lot of people to go through. You're doing a lot of hiring, and you're
Yep.
probably doing a lot of letting people go that aren't fitting to the culture or the environment. What are you looking for? You've had a lot of experience now with hiring individuals. What are you looking for in an individual to fit your team, your culture, your environment?
Mm-hmm. Yeah, I mean, I think we've definitely gotten more refined over the years, and now, if we have someone that we've hired who is really not a good fit, that's really on us. That means that in our interviewing, our onboarding process, we didn't ask the right questions, or we didn't help someone find a place that they'd be happy. So we're really looking for people who like that startup mindset. I think medicine tends to be a little bit more traditional. So we'll see a resume from somebody who, has 15 years experience in a city hospital. They might be a terrible fit for us because we are growing, we're changing, we're not using some of the older technology. So we need people that want to be in that building the plane while they're flying it kind of culture. And at the same time, which is, I think, tricky, is we want people who also have reverence and respect for science and privacy and evidence and doing things in a very reverent way as well. So it's a very tricky balance of people that sort of respect traditions and want change at the same time. And so we interview for that. We look for people who aren't afraid to ask difficult questions, people who aren't, most importantly, I think, aren't afraid to say what they don't know, right? And say areas that they are weaker in, and they look to get help. We're not looking for lone rangers or heroes. We're looking for people that really kind of want to be part of something kind of bigger than themselves.
And I can imagine you probably get that when people go into this field. You have a lot of solo practitioners, people that are doctors and therapists, and they go in and want to do a certain thing, and they usually have a private practice of some kind, or they're part of a group, but they still get funneled patients, and then they
Mm-hmm.
work with that one patient over time. And you found over the course of your career that those are not the people that work well, that just want that just want, like, I want a one-on-one relationship with this one person, and just give me my clients and then I'm good.
That's right. That's not a great fit for us. So I would say, from a clinician standpoint, we get kind of two groups of people. We get some people who love teamwork, love academic work, love to be in this learning environment, and have worked at area hospitals, or not in this area, but around the country, and have found that there's like a lot of bureaucracy there, and that it's slow moving, and actually not as innovative and academic as they had hoped. So they're leaving the traditional academia to work with us, which is more of like startup mental health. Those people work out really great, on our teams. And they bring a wealth of institutional knowledge. And then the other type of person is somebody who maybe started out in private practice, but found they really liked the more challenging cases. They really liked people that were having a lot of suicidality and self-harm or bipolar. And they found that's not a great fit for their solo practice. And they're really like, craving connection with other clinicians. And so they leave their private practice and come to us to be part of a team. So,
Wow, that says a lot about the individual, and it says a lot about you to try to find that fit and who you're trying to collaborate with. You speak a lot in our conversations, our notes, about technology and
mm-hmm.
how you're using technology to help build culture and collaboration inside your organization. Tell me a little bit about that.
Mm-hmm. Yeah, so I think we have always been kind of tech forward. You see some mental health practices that are still kind of using paper, and there's nothing wrong with that, but it doesn't really work when you have these distributed teams. Particularly doesn't work when COVID hit, right? So we were, I think, pretty easily able to pivot into that environment because we were already technologically connected. We do use a program called Spruce Health. We were very early adopters of Spruce. They're a team out in California, and they're great. And they originally started for dermatologists to make this like communication platform for patients and clinicians. But we really early on worked with them and adapted it more for mental health. And so the way that works is if somebody is interacting with one of their patients and the patient is having a harder time, and that clinician needs support, or even that administrator, maybe the front desk associate needs support, they're able to call, kind of like a Slack type situation. They're able to call on their peers within the company to help them and guide them. And that allows us also to work with trainees, therapists that don't have as much experience, because they're not really alone with the individuals they're working with. They have a team kind of behind them, backing them up. So we've used that very early on. And then the other things that we do, there's a program called 15-5. I'm not sure if you're familiar with that, but it's for it's really focused on positive psychology within the workplace. And it does kind of weekly check-ins with the employees about how they're feeling, what they'd like to be different, do different about their job, issues they're having. They also can give recognition to each other with high fives online. And it's kind of an HR platform, but it's really positive focus. So it's not just a place to kind of complain. And we have people doing that every week. And I think particularly with the remote workforce, that allows us to kind of keep a finger on the pulse of people that we may not be, seeing in the office anymore.
You talk about having a mentalized workplace.
Mm-hmm.
What does that mean?
Yeah, so that's it's a kind of a fancy word from this British school of psychology. So mentalization-based treatment was started at the Anna Freud Center in London as a way to work with people with personality disorders, people that were finding other therapy to be not helpful, very mistrustful of help. And that's an individual type of therapy called MBT, but there's also an adaptation of it for teams. That's called AMBIT. AMBIT means sphere of influence. And so basically we use that approach with our whole team. And the approach is based on taking a curious, not knowing stance, try to understand misunderstandings. The key phrase is seeing yourself from the outside and others from the inside. So if there's a misunderstanding between someone at the front desk and a clinician, we try to take this sort of curious, not knowing, non-judgmental approach to it, rather than kind of let emotions escalate to the point where saying, I can't believe, she did that she did that on purpose. She's always doing that to me. She's always messing up my schedule. Those types of things that happen in the workplace, we're able to kind of break them down using that curious, mentalized approach.
How are you finding out more about the other people in the workplace, right? The more understanding. So I really love that of looking, let me see if I can rephrase that right. You look at yourself from the outside,
Mm-hmm.
right, of how people see you, but you're also trying to understand people on the inside and why they may behave or act a certain way. What are you doing to kind of dig deep into that and to understand that?
Mm-hmm. Yeah, so some of it is through, regular supervisions, both one-on-one supervisions and group supervisions that are more like supportive in nature, where, members of the admin team might get together and instead of just complaining for an hour about the clinicians, would actually have facilitators that are trained in mentalization. We've actually brought facilitators over from across the pond, thanks to Zoom, to help lead these sessions, to teach the administrators to think like we do as clinicians, and to think about why a clinician might have done something or why a patient might have done something, right? Because they're also on the front lines dealing with, when you call a doctor's office, there can be frustrations, there can be misunderstandings, emotions can flare. And so we're kind of arming them with the tools that we use as therapists within their workplace. And then the same for the therapist as well. Of course, we have supervisions and things for that. But
okay, that's really cool. I've never heard really put that way, but I can imagine that that an office or a workplace full of psychiatrists, you're constantly analyzing each other. Am I right?
Yeah, I mean, it's like we get frustrated, everyone gets frustrated from time to time, but I think we're better at checking ourselves, or we do sort of a lot of, calling out the elephant in the room when we have conflicts. And yeah, and I think the thing about mentalizing is it's not knowing stance. So someone missed a meeting the other day with their supervisor, right? And instead of kind of what we call hypermentalizing and telling all these stories in our heads about why that person missed, we really come from there probably was a good reason. Let's find out what that reason is. Let's kind of give them the benefit of the doubt. And no matter what that reason is, that's going to be data that we can now work with, right? And so that's what we strive to do, at least.
So innocent until proven guilty.
Yeah, I mean, most of, we recognize that people's actions, they make sense from the perspective they're coming from. And we also will ask questions on our weekly 15-5s, like what's one aspect of your role at the company you think people don't understand, or you think people commonly misunderstand. And that's been a really helpful question to kind of people, see how people think others are seeing them, and kind of the stereotypes, the biases, and also just some of the blind spots we have, right? Some people were just looking at the administrative staff as this monolithic thing. I'm just going to ask someone over there to do a thing for me because I don't really know who they are, versus like, this is what this person does. This is what this person does. This is how they approach their job. And by the way, they have, 30 other things on their to-do list today. So helping everyone to kind of see in each other's shoes kind of thing.
And hold on, did I just hear you say you have weekly 15-5s with the entire group? How does that work?
So basically what a 15-5 is this great company. They say that the employee should take 15 minutes to fill out this online thing. And then it takes 5 minutes for the supervisor to review. I actually think it could take less time than that. And that we can put questions on there that have to do with workplace culture. They have some built-in ones you can ask, but you can also customize your own. So we've put in there some questions that I think take a more kind of mentalized stance. We'll even ask, like, what was one misunderstanding you had this week at work, and how did you deal with that? So it's getting people to think about things very deliberately about their workplace. And I would say the data that we've gotten from that to be able to, actually take action and change things is quite striking. And I don't think we would have gotten it just from like a, 6 month employee annual review kind of thing. I don't think that's particularly effective.
Yeah. You got to have this constant reminder, this constant engagement, because you miss a lot in 6 months.
Yes.
If you're waiting every time to do 6 months, you're going to miss a lot. And so that weekly reminder, that weekly engagement, and also not just observing, listening is a huge part of that, and reading and engaging, but action. You said action, which has to be tied to the problem, to the solution, to whatever you're doing. That action is so critical.
Yeah. And I think we find sometimes people, they won't say something to our face, but they'll put it on a 15-5, right? And some people have a lot of ideas and we would never heard them. And some of them are like, might be kind of complaining, but we take them like, we're glad you said that, because now we know, and now we can do something. And so that's how some of our support groups have formed. That's how we have a town hall every 2 months. That was a result of people putting stuff on there. And we even have these culture committees that we have in the workplace based on kind of what people were saying on these weekly check-ins.
So you're kind of a workplace culture superpower. I mean, it's like you've got
we're trying
tools in place. You've got these committees in place. That's fantastic. And you don't get that all the time within, smaller businesses, especially in these medical fields, because a lot of medicine is all about patients and churning through patients, right? Because that's billable, and we got to get through that. And we definitely don't have time to take an hour or half hour out of every week to focus on company culture.
Right. And that's why I think, physician burnout is high, physician suicide is high, right? It's just, it can be kind of a thankless job without kind of paying attention to the culture. And so we're very deliberate about it. I think a couple of years ago, myself and our COO went to the Culture Summit in San Francisco, and it was just like, I don't think there were any other medical practices there. There was like, Uber and Salesforce and, smaller companies too, but there was just nobody from the medical field. It was just not there. It's
Why
just
is
kind of
that?
not on their radar.
Why is
I
that?
think, the culture of medicine is also its own beast. It's its own thing. It's what we're indoctrinated into. And I think it's the hospital-based, quite hierarchical, almost a bit like the military, I would say in some ways. And I think that culture is really important because the stakes are really high in medicine. But I also think there's aspects of it that can be kind of outdated and not particularly innovative and not really geared towards the workforce that's, particularly some of the younger workforce that's coming, that we're working with. It's just not, it doesn't have as much for them as we would want.
It's hard to connect, right? It's they're kind of coming from that old school way of life and thinking, and you're doing different things now. We've talked about a few of those now. And another thing you do that's really, really important for you, your workplace, your culture, your environment, it's on your website, it's on your Zoom label, is the inclusiveness, gender identity, things like that. Talk about that as relating to why that's so important for you, why you put it out there, and what you hope to achieve because of that.
Yeah, it's kind of in the name too, right? In Brooklyn Mines. Where we live in Williamsburg, this kind of really diverse place with all different types of people, different ethnicities, different gender identities, different sexualities. Not everyone's neurotypical as well. We have people with different learning styles, people with psychiatric conditions that they're open about in the workplace. I think that our workforce reflects the people that we're caring for, and that makes it go better, and that builds more trust. There's just more connection when we have all these different perspectives. So it's very important to us, and always has been important to us to try to try to do that when we're hiring and when we're recruiting.
So you hire people that reflect your patients that are coming in.
Yeah. I think empathy is a huge part of what we do. And so people that get that in some way, and there's many different ways to get that, that's who seems to want to work for us as well. And so those are the people that stand out in the application process. You can tell that they're, it's not just any job, it's not just any office. Like they really want to be in this field, working in the trenches. And usually, that comes with some kind of personal experience of some kind, especially I think around gender identities. We have so many patients in our practice who are having different gender identities and exploring that and facing discrimination with that. And so, having employees kind of across the company with different gender identities just adds a whole other kind of dimension.
What does that do? What do you hear from your patients as a result of that?
Yeah, I think that they find it refreshing. We're not the only mental health practice that is doing this. I think that there's definitely therapists are becoming more attuned to this, and we'll see a lot of patients who are specifically coming to us for that. Or wanting to work with a therapist who has a certain type of background, whatever that may be, whatever it could be a certain cultural background, could be they want, they have substance use, so they want a clinician that's in recovery. You see kind of all different kinds of things within our field, and we want to be able to serve those needs.
That's awesome. Let me read this statement that you wrote really quick.
Oh, sure.
I asked you and this question earlier, what are some of the biggest mistakes companies make when it comes to company culture? Mm-hmm. And you said not tending to it, not acknowledging the issues within a workplace culture, and instead focusing on empty initiatives and buzzwords. There's often a stated culture, that differs from reality.
Mhm.
Tell me about that.
Yeah, I mean, I think that's you see a lot of companies wanting to come up with their list of values and putting nice things on the website. But then when you're actually asking the people who work there what the culture is like, you're hearing a different thing, and we recognize that. One of the committees that we have is called the Change Committee, that really is just very much focused on this idea of like, well, maybe there is this one culture, but then there's also this unsaid culture, and if you don't acknowledge that unsaid culture is going to it's going to cause problems. It's going to be kind of this sort of pretend culture situation. And I've certainly worked in workplaces like that before, and it's not a great place to work. Every workplace is going to have conflict. Every workplace is going to have a changing culture, and you have to go with that. You have to be open to that.
In a world of social media and being exposed to a lot of things that seem inauthentic to us, authenticity in the workplace is becoming more and more important. And it's not just as an external brand seeming authentic to our customers and clients of saying, hey, we're saying all these things, let's be that, but it's authenticity to the people inside the organization to say, hey, we believe this, we want to do this, we want to represent this.
Mm-hmm.
And then those type of employees coming on and saying, yes, I want to be that too. I want to belong to that. That's
Right.
real. And then once you have that agreement of, hey, we want to be this, and somebody's saying, hey, I want to be part of that, then actually doing it and making it real and being authentic. Because what happens is that a lot of companies aren't, and they're getting called out on it now.
Yeah. And I think we, the people that do our social media, you can probably tell if you looked at it at a point where we went from having like an external organization, helping us with it, to having just internal people. And we found when we've had internal people, they really get the culture and they really represent us better. It feels different. It looks different. I don't have to micromanage it. It just represents kind of who we are. So we've also learned that in terms of working with kind of outside agencies that just don't get it because they're not here.
As a Harvard trained psychiatrist, now being a CEO, making that transition to be the person doing all the work of the treating patients and to helping them, and to being the leader of an organization, what's that transition been like? What are some of the pains that have come with that? And what are some of the rewards?
Yeah, I mean, I think in my work as a psychiatrist, I've always liked working with people who maybe started out kind of isolated, and like building kind of a team around them, building support around them, and seeing kind of what potential they have, right? And the potential kind of unlocked is like, you see that in patients. And I think when I transitioned more to a business role, it was the same kind of thing, only it was with employees. It was with team members, is finding someone who maybe is, a little bit like unpolished and doesn't have much experience, but really helping them kind of see their strengths and growing within the company. It feels very similar to me. It feels very similar in terms of building a team and then seeing it function on its own, right? Because when you're working with a patient, your goal isn't to have them always be dependent on you. It's so that they don't really need you anymore. And I think that's the thing, as I'm building the company, the more people can do things in the company and more departments can function with much less oversight. It's a very similar and very like rewarding experience to see like, oh, well, I wasn't at those meetings this week and they seemed to go fine and they were good. And that's great. Like I'm happy to be left out at that point. I'm happy to be kind of peripheral.
It's hard to let go sometimes, especially when it's your baby and you've grown this thing and then you're turning it over to somebody else and you're like, are they going to run it like I would? I hope so. And
yeah, and I'm still involved, but I just think that's why the hiring is so important, and finding people who you think can contribute to the culture in a really synergistic way, who aren't just like clones of me too, right? Like that would not be good if I was just hiring people that were my strengths. So I'm hiring people who are like, I don't know how to do what you do. Like, this is great. You need to be here.
Yeah, I've learned on my own personal leadership journey that I really suck at some things. And I was like, what? I suck at that? Like,
Yeah, but you know
and
what?
then it's like hiring people on that can help you and carry the organization forward. So this is really great. I'm gonna tie this in because you said it beautifully. You used to unlock the potential of these patients.
Hmm.
And now you've just transitioned to unlocking the potential of your employees and your staff.
Absolutely.
That's beautiful. Not only because it's the title of the show, but
That's what I did
because
there.
it's awesome, right? That's what we do. And on our journey, and sometimes we get scared of leaving that because we're like, oh, but that's why I went into business to impact those people and to impact the population. But then trying to reframe our minds to say, well, I am
Hmm.
indirectly, I'm impacting the lives of my employees, my staff, helping them learn to impact more people. If you
Yes,
get that, you'll be able to impact more people at scale, right?
absolutely.
You're just going to impact so many more than you could by yourself.
And that's, I mean, that's part of the thing of like, as I definitely am still, I still think most, clinician administrators still see some patients, and I still always want to do that. But I've also just recognized that that is not going to scale. Like I really need to be able to train others to do this too. And so that's why we built the practice.
Right on. Is there something you can provide the audience? Are there resources that we can find out more about you, or things if we're having issues with certain things and that we need to talk to somebody? What can we do?
Sure. Yeah. So you can go to our website, www.brooklynminds.com. Similarly, find us on social media, Instagram, Twitter, etc. We do have a, get connected with us button on the website. Very easy to reach out. And in addition to patient care, we also do workplace consulting and support for employees within companies, if that's something folks are interested in.
Fantastic.
Yeah.
Carlene, this has been awesome. You seriously are a workplace culture powerhouse, and it's awesome. I wish we would implement a lot of the stuff you're doing. We do a lot of stuff inside my organization, but the intentionality that you've shown here is awesome. And sure, it's not perfect all the time, but you're intentional about what you're building, and that's what I admire. So well done. Hats off to you. And thanks for being on the show. I really appreciate it. And have an awesome day.
Thanks for having me.
We didn't cover this in the interview, but in the questionnaire that I sent earlier, she responded with something that was really interesting, a statement that she said, workplace culture is to the workplace what broadband internet is to doing anything else online. It provides a foundation for everything we do. We can't access our true potential. We cannot, let me rephrase that, unlock our true potential without first creating a strong foundation. And that's what workplace culture does. It creates that foundation for us to flourish, for us to do the things that we need to do, and to embody who we are and who we need to be. Authenticity, we talked a little bit about that. We talked a little bit about growth. We talked a little bit about opportunities and how you can scale and grow based on bringing people in that think like you. Thank you, Dr. Carlene MacMillan. I appreciate you. And if you want more of these interviews, they're on my website at skotwaldron.com. You can also find them on my YouTube channel. Go there. There's a bunch of them there, along with some other free resources and tools. Thanks for being here, and we will see you next time.